This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
This past week was Women's Health Week, and so we're going to focus on women's health issues this morning on Columbus Concerns.
We're talking today with Dr. Michael Kakovic from the OSU Wexner Medical Center. This is Women's Health Week, and Dr. Kakovic, thanks for joining us. And what are some of the issues that you would like for women to think about this week?
Hey, good morning. I guess the biggest thing, I think you can put women's issues into two categories, pregnancy and non-pregnancy, or GYN. I think that as far as pregnancy goes, one of the issues that's facing us right now is that a lot of women possibly aren't getting the care they need because there's too much emphasis on the fetus or the care of the fetus. And one of the things I tell my students and residents that I work with is the most common cause of fetal death is maternal death. And I know that sounds like a dramatic explanation, but it's true. I mean, we have to take care of our moms. We have to keep our moms healthy. So you can't withhold treatment based on the fact that she's pregnant. You have to actually treat her as if she weren't pregnant and deal with if there is a consequence or risk to the baby, the benefit to the mom outweighs the risk. So I think that's something that's kind of coming full circle now in our discipline about not forgetting that the mom is the most important part of this equation, because if we don't keep her healthy, the baby's going to suffer as well. And the example of this is with depression. There's been some reports in the last couple of years about withholding antidepressant meds to mom because they may have some effect on the baby. And one of the effects for the baby is neonatal abstinence syndrome. But the risk of that is about 1% to 2%, and it's self-limited and goes away and doesn't cause any long-term problems on the baby. But if we withhold antidepressant meds in a woman who's really depressed, I mean, you can imagine what can possibly happen to that woman during pregnancy or after pregnancy, and by consequence, the baby as well. So that's just kind of an example of some of the challenges that we have now in perinatal medicine.
And what are some of the other health issues or concerns you would have for an expectant mother?
I mean, the other thing, too, has always been weight gain and weight loss. I mean, we don't obviously ever advocate losing weight in pregnancy, but the bottom line is that women need to stay healthy. And obesity is an epidemic in the United States, something that we see every day in Ohio as well. And women need to stay fit. And the women that's thinking about getting pregnant should take that opportunity to get down to a reasonable weight, exercise, and start an exercise program and continue that exercise program when they're pregnant. Too often times they get some pressure from family members and such that they're not eating enough and they overeat, and obviously that also causes problems with the pregnancy and with the baby as well. So I think that good preconceptual care, talking to your doctor when you're considering pregnancy, is the opportunity to really kind of get to the bottom of all those issues. I mean, let's face it, young women don't go to the doctor. They don't need to go to the doctor. They're generally pretty healthy. But if they want to have a pregnancy or a healthy pregnancy, it's a good opportunity to go to the doctor, find out if there's anything that they need to do or anything that they can get in control before pregnancy occurs.
And if you're talking to a woman who maybe doesn't want to get pregnant or is done having children, what are some of the options that women today have in the birth control range?
Well, a lot of things are basically, I think, short-term and long-term contraception. I mean, a woman that doesn't want to have any more children but doesn't want to commit to sterilization or tubal ligation, an IUD is a perfect option. There are basically two types of IUDs on the market. There's IUDs that contain progestin that can be left inside for 5 years, and then there's ones that contain copper, which can be left in the woman's uterus for 10 years. And those are excellent methods of contraception that actually the failure rate is much less than surgical sterilization or tubal ligation. But if a woman wants to have a baby and is family planning, something like the pill or the NuvaRing, which is a contraceptive insert that a woman uses monthly, is a good option because they can finish out their cycle, go off of it, and ovulate and get pregnant again. There's some longer-acting progestins that are also used that are easy to use, like Depo-Provera, that that you take every 12 weeks. The problem with a woman who's trying to not raise a family, but to plan a family is that the return to fertility on those medications can take a long time. So they're basically not really the best for somebody who's planning on having a child, every 1 to 2 years. Usually the pill or just barrier method is usually the best thing for a woman who's just kind of planning out family.
I was just preparing for this interview, just thinking about women's health in general. I was looking at some of the diseases and things that women need to be concerned about, and they're very similar to the ones that men would, heart disease and cancer and other things like that. So I imagine with any disease, what I always hear when I do these interviews is go see the doctor regularly and make sure that if there is something wrong, it's detected early.
That is correct. And another example of that is the one disease process that we worry about in pregnancy that's unique to pregnancy is preeclampsia. Preeclampsia is an interesting disease because we know what the cure is, but we don't know what causes it. There's lots of theories, of which one of them is genetic, that it's almost like half the baby we know is foreign and half the baby belongs to mom, so perhaps it's some sort of kind of rejection of the foreign DNA in the baby. Again, that's just a theory. But the whole basis of prenatal care in the United States and in most developed countries is the screening and management and evaluation of preeclampsia. And, anybody that's been pregnant knows, about the 9-visit pathway, usually about 9 visits for a routine pregnancy, but they're backloaded. So most of those occur, you're seeing them every month until about 28 weeks, and then every 2 weeks till about 36 weeks, and then every week. And that's really to manage preeclampsia. And preeclampsia has been shown to be a risk factor for heart disease in the future. So it's also good that if a woman has had a pregnancy that's been affected with preeclampsia, that they let their primary care physician know that so they can be screened and seen regularly to make sure that hypertension or heart disease or cholesterol or any other issues actually develop later in life. So it's kind of like a stress test for heart disease.
Where does the OBGYN come in when it comes to the overall health of women? And is there a rule of thumb on how often a woman should see an OBGYN as opposed to just seeing her regular family physician?
Well, that's a great question. Obviously, most women see their OBGYN, they're pregnant or contemplating pregnancy, or if they want to know birth control options. I think a lot of primary care doctors or family medicine doctors are very comfortable talking about those kind of things, and if not, they can refer to the OBGYN. It's kind of a little bit in flux now. Women used to automatically go to see the OBGYN every year and get a pap smear, but now that some of those requirements have softened a little bit, if a woman never has had an abnormal pap smear, it isn't at risk for cervical cancer or cervical dysplasia, so they often don't have to go. But usually I think that it's a lot of women, especially middle-aged women, are still in that process of going to see their OBGYN once a year. And it's one of the reasons why I went into OBGYN actually is because, it's long-term. It's a little bit of prevention, it's a pregnancy, it's dealing with certain GYN problems, and then it's nice to see patients that you've delivered their babies every year for subsequent years afterwards.
And should women, when they come to the doctor, should they have a list of questions if they have any issues at all?
I love that because I don't personally have a spiel. I try to treat everybody as individuals, so I love when they have questions. I love when they're written down because it shows they're prepared and they have particular issues. So, I mean, maybe some doctors don't like that because it takes up time, but personally I do like that. But one other thing, is that with breastfeeding, we always advocate breastfeeding, and sometimes women with medical conditions are on certain medications that may not be compatible with breastfeeding. So that's always a good thing to ask your doctor when you're pregnant, so it's not something that comes up as a last resort after you've delivered. You're like, can I breastfeed on this particular medication? So when I do a consult on somebody with a medical problem, that's another thing I try to put in there about what the American Academy of Pediatrics says about lactation and using the medication in breastfeeding, because a lot of the medications do cross, but most of the time it's not in a large amount, but you always want to make sure that amount is safe for the baby.
And again, right there with asking the questions would be come in prepared to tell your doctor all the medications you're on.
Exactly. 75% of diagnosis is history. So, a lot of, now that we're in this kind of computerized world, everything's in the computer, and a lot of people still rely that, it's going to be in the computer, don't worry about it. But the reality is what you tell me is what I can deal with, and I'd much rather hear it from you than read it in a computer anyway.
Very good. Well, thanks so much for talking with us today about Women's Health Week.
All right. Thank you for having me. I appreciate it.
Well, in another topic on health, school is starting again, and a recent report in the Columbus Dispatch was disturbing. It said the teachers have been finding more and more vaping products on students, some as young as fifth graders. So we thought we'd bring you this morning this report from the Centers for Disease Control and Prevention on vaping products.
Today is Dr. Brian King from CDC's Office on Smoking and Health. Thank you for joining us, Brian.
Thanks so much for having me. It's a pleasure to be here.
Our topic today is e-cigarettes. Can you tell us why they're considered a tobacco product?
Yeah, so in the United States, we regulate tobacco products through the U.S. Food and Drug Administration. And the way they describe a tobacco product is any product that's made or derived from tobacco. And we know that the vast majority of nicotine that's used in tobacco products, including e-cigarettes, is indeed derived from tobacco. And so since these products contain nicotine, we consider them a tobacco product in the United States.
And e-cigarettes are a little bit different than regular cigarettes. Can you describe how they work?
Yeah, so e-cigarettes is short for electronic cigarette, but we know them by a lot of different names. And they can be called things like vapor products, hookah pens, vape pens. But the bottom line is they're all really the same product. And they work by containing a liquid that's heated, which the user then inhales into their lungs. And it's important to note that this isn't technically a vapor, which is how people frequently refer to it. It's actually an aerosol that contains small particle as well as various other ingredients that the user inhales. And so there's no combustion, you're not burning anything, but there is a heating of a liquid which turns into an aerosol which the user inhales, and they can also exhale into the air as other bystanders are around them.
And the aerosol is not just water vapor. I mean, that's an important part to understand because I get asked as a physician about e-cigarettes, and the thing from the session that I found very interesting was the idea that we're not really certain about the risks that flavorings add to e-cigarettes. The one that was mentioned was the butter flavoring, diacetyl, that has been associated with bronchiolitis obliterans, or what's called popcorn lung, which is a deadly disease. What more do we know about the risks of e-cigarettes?
So our knowledge about what's contained in both the e-cigarette liquid as well as the aerosol has continued to evolve over time. These products entered the United States marketplace in around 2007. And they didn't start to really uptick in use until 2010, 2011. But since that time, we've really increased the amount of research into what these products contain. And what we can say is that the aerosol emitted by these products is not harmless. We do know that the ingredients and the levels are significantly less dangerous than conventional cigarettes, but that doesn't mean that they're completely risk-free. And so some of the ingredients we've found in the e-cigarette aerosol are things like ultrafine particulate that can be inhaled very deep into the lungs, and also heavy metals that are found in the filaments of the device and are emitted in the aerosol, as well as things like volatile organic compounds. But one of the most common ingredients is nicotine. And we know that nicotine is highly addictive, but there's also evidence indicating that it can harm the developing adolescent brain, which really makes it important for youth to avoid these devices. In addition to some of these other harmful ingredients, we also know the flavorings. And so diacetyl is just one, but there are a variety of different flavorings that are used that, although they may be safe to ingest in things like food, we don't know what the risks are for inhaling these devices into the lungs. Your gut can handle a lot more than your lungs, and that's really important when we look at the ingredients in these products. And finally, it's also important to remember that people are using a lot of things in e-cigarettes, and that includes other psychoactive substances like marijuana and THC and others. And so when we're talking about youth in particular, the use of both the nicotine-containing varieties as well as other varieties for other types of drugs are really a public health concern.
Okay. But we have had some recent good news about the youth, meaning middle school and high school use of e-cigarettes. Can you tell me about that?
Yes, it's really a commendable public health accomplishment. We started assessing e-cigarette use among youth in this country in 2011, and through 2015, we saw exponential increases in the use of this product. And 2016 was the first time that we actually saw a decline among youth in this country. And that was really a result of the coordinated efforts to not only educate the public about the harms of youth e-cigarette use, but also implementing common sense strategies to not only prevent youth access, but also to protect people from the aerosol in public environments and various other campaigns to educate people about these products. But on balance, the bad news is that we still have over 2 million youth that are using e-cigarettes, and they're now the most commonly used tobacco product used among U.S. youth. So we've made great progress, but we really need to continue that momentum to reduce all forms of tobacco product use among youth.
So it's going down, but not as much as we'd like. So what's driving the use of the e-cigarettes in teens?
So there's a variety of factors that we believe are contributing to these increased rates of use among youth that we saw through 2015. One of the most notable is the advertising for these products. We know that many of the themes and tactics that have been used to advertise conventional cigarettes are frequently used for e-cigarettes. And we also know that there's some media for which conventional cigarette advertising is banned that is allowed for e-cigarettes, things like television. And so there's really a prominent advertising of these products, and we know that it's reaching kids in particular. About 18 million U.S. youth reported being exposed to e-cigarette ads in 2014. Another factor is flavorings, and we know from the existing science that flavorings can be particularly appealing in terms of enticing youth and young adults to use tobacco products, and a variety of e-cigarettes are flavored. And we know from the existing data that about 2/3 of youth who use e-cigarettes report using flavored varieties, and flavors are the most commonly cited reason for why youth started using these products. And so in the end, we really have a situation where the advertising is bringing the horse to water, the flavorings are getting them to drink, and then the nicotine is keeping them coming back for more. And so it's kind of a perfect storm in terms of the youth rates of this use. But the good news is we know what works to prevent that. And if we implement those common sense public health strategies, we can continue to see the declines that we saw within the past year among our nation's youth.
And the real concern is about nicotine and the teenage brain. Can you just briefly tell me a little bit more about that?
Yeah, so nicotine is found in the vast majority of e-cigarettes that are sold on the U.S. market. And, nicotine we use in things like nicotine replacement therapy among adults, and it can be, an effective drug to help people quit conventional cigarette smoking. But it's important to note that those are in very measured doses, and that it wanes the individual off of conventional cigarettes over time. But nicotine is not necessarily risk-free, particularly for vulnerable populations. We know that nicotine is highly addictive, but there's also a growing body of scientific evidence that was outlined in a recent Surgeon General's report noting that nicotine exposure can harm the developing adolescent brain. And we know that the brain continues to develop into young adulthood up through 25 or 26. And so there's really implications for not only youth use of these products, but also young adult use of any nicotine-containing product.
Yeah.
And another thing to remember with nicotine is it's also been shown to result in adverse health outcomes among pregnant women, and particularly fetal toxicity. So there's also implications about pregnant women using any form of nicotine-containing product. And so it's really important for them to talk with their physician before they use any type of nicotine-containing product, including e-cigarettes.
So is there a place that physicians could go to learn a little bit more about these parts with the e-cigarettes and the nicotine?
So there's many resources that have been developed over the past few years, particularly as the science has begun to grow and we have more concrete evidence about what works effectively to help warn people about these products and also provide them scientific-based information to make informed decisions. And in 2016, the U.S. Surgeon General released a landmark report on e-cigarette use among youth and young adults. And as part of the release of that report, there were several materials, including resources and provider cards to help health professionals really communicate to their both children and adults about these products. And so in the context of youth, it really enforces the importance of warning them about the dangers of these products, particularly with regard to the nicotine content. And among adults, it's a more nuanced conversation about knowing that we do have FDA-approved medications to help people quit, and those should really be the first line of defense to help you quit. And if that doesn't work, you can consider e-cigarettes, but in consultation with your healthcare provider. And right now, based on the evidence we have, there's no conclusive evidence that e-cigarettes are effective for long-term cessation. And so it's really important to use those resources that we know are most effective to help you quit in coordination with your healthcare provider.
And then for youth, where, if parents or other adults wanted to know more about how they could talk to teens and young adults about the risks of e-cigarettes, where would they find some information about that? So
as part of the release of the Surgeon General's report, there's an excellent interactive website that was coordinated with the release of that report, and it is e-cigarettes.surgeongeneral.gov. And it has a variety of information on both the report itself, as well as a public service announcement, as well as informational cards for both parents and clinicians to educate youth and young adults in particular about the dangers and risks of using these products.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.